All right, good morning, everyone. Thank you for joining us. My name is Renita Polk. I'm the Assistant Director in the Office of Direct Care Workforce with the Department of Aging. And we're gonna go ahead and get started. So first, I'll just go over the agenda. First, we're gonna start out with an introduction to CDA and CELED. Then I will give an introduction to the CalGrows program. We'll talk about the offerings of the program, and then we will talk about how you all on this call can help us to promote CalGrows. And then we'll have time for questions at the end. Just some general info before we get started. Closed captioning and live transcription is available. So you can click on the live transcript link on your Zoom navigation bar for closed captioning and to enable that setting. The slides, video, and transcript will be available in the Outreach Partner Toolkit that will be shared later. And if you have questions, we're asking that you put them in the Q&A box, and we will answer as many as we can during the webinar. So with that, we'll get started. So just an introduction to the Department of Aging and who we are. The Department of Aging is under the umbrella of the California Health and Human Services Agency, and it administers programs that serve older adults, adults with disabilities, caregivers, and residents in long-term care facilities. These programs are funded through federal dollars through the Older Americans Act, state dollars through the Older Californians Act, and also through the Medi-Cal program. CELED is the third-party administrator of the CalGrows program. They are a global social enterprise company, and they will be providing backbone support services and administering the Innovation Fund and program support for CalGrows. So likely if you reach out to us via email with questions, one of the CELED team will likely be interacting with you. So I want to talk about the goals of the CalGrows program. And so the primary main goal of this program is to improve quality of care for older adults and people with disabilities. And how we're going to do that is by training the caregivers that care for older adults and people with disabilities. So the program, we want to try and centralize statewide training. We are creating a database of different training opportunities for workers that they can search and learn about different trainings that are offered. We are also providing incentives for paid direct care workers to participate in training as part of the program. And also we want to increase satisfaction and retention of caregivers. We all know that with our older adult population, that quality of care and consistent care is very important. And so improving retention of caregivers is also really important to provide that consistent quality of care. And then also to provide career pathways to caregivers. So helping caregivers think about where they want their career to go, and then helping them reach those goals. Okay, so I'll give just a bit of background to kind of orient us all. There is an expected labor shortage of 3.2 million paid direct care workers. And with in California's population, by 2030, we are going to see a significant increase in the older adult population. By 2030, 25% of California's population will be over the age of 60. So we're seeing this increase in the older adult population, but we're also seeing a labor shortage. And though we know that caregivers are disproportionately women and immigrants, there's some data here on this slide, 80% women, 47% immigrants, and 51% receive some type of public assistance. So that also tells us that these workers are largely underpaid. And so with this type of work, there's a lot of stress, there's a risk of job-related injury. And I also, most of the statistics on this slide refer to paid caregivers, but I do also want to point out the importance of unpaid family and friend caregivers that provide 2/3 of the care that older adults receive. And so our program, we will be training both paid caregivers as well as unpaid family and friend caregivers. So those two types of caregivers will be allowed to participate in the CalGrows program. So the Master Plan for Aging, folks on this call, you may or may not have heard about the master plan, but it is the state's 10-year plan to prepare for this increasing older adult population that I mentioned earlier. And the Master Plan for Aging was launched in 2021 with over 100 different initiatives that fit into one of these 5 goals. The CalGrows program fits under goal 4, which is caregiving that works. And I will say that the CalGrows program is not the only program that is being implemented to assist caregivers. So there are programs at other departments, other agencies that are also working with caregivers. But I did just want to provide that context in the Master Plan for Aging and how the CalGrows program fits into that state's larger plan to prepare for that increasing older adult population. All right, so I want to also talk quickly about program eligibility for for CalGrows. So I mentioned this earlier, but I just want to kind of state it here as well, that this program is for paid direct care workers in the home and community, but also for unpaid family and friend caregivers. So both paid and unpaid caregivers will be able to take the courses offered by CalGrows, and they will be free of charge. I do want to point out that those who work within the in-home supportive services program, or IHSS, are not eligible for the program, and direct care workers that work in settings such as hospitals or skilled nursing facilities where a higher level of medical care is offered and in institutional settings are not eligible for the program. All right, and I will now pass it over to Angela Parikh, and she will cover this slide.
Thanks, Renita. Hi, everyone. So I'm Angela Parikh, just a brief introduction. So I am the Director of Public Sector Partnerships at CalEd. So I've been working closely with Renita and CDA on this CalGrows project. So getting into, now that you've had that amazing background of this program, with having you on this webinar, we're needing you to help spread the word. So this is where we can help put $50 million in the pockets of caregivers. So we're needing a like-minded network of organizations to help spread the word. So we're bringing you together. The caregivers know and trust you, and we're going to make it easy for you. We're going to be able to provide materials, flyers, blurbs, and more in order for you to be able to spread this word of this amazing program. Some basic, the caregiver benefits that they're going to gain as the training, the free training like Renita had spoken of, free coaching, and then incentives for the paid caregivers only. And I'm going to be able to show you just a little bit of a tease of the CalGrows website here. So in this CalGrows website is going to launch on March 15th of this month. And that is where caregivers will be able to search for courses. They're going to be able to get information and contact information about coaching support. And then that is where they'll be able to submit for incentive claims for the trainings that they did complete. So at this time, I'm going to share with you just the overall CalGrows website. The full launch will take place, like I said, on the 15th, and that is where the full course catalog will be available. That is where the caregivers, once they complete training, will have be able to make their incentive payments, and then the career coaching, of course. So here we have our homepage walking through. Just here's what you're, as a caregiver, you're going to get free training courses to enhance career growth opportunities, on the job skills for better care for recipients. The one-to-one career coaching. So this is free support. This is not a helpline. This is where caregivers can go and they can set goals. They can talk to a coach. They can get regular communication from a coach and touch points from them. Also able to get them resources. And then, of course, for those that do qualify for incentive payments, those are the paid caregivers, they will be able to get that incentive payment. And Renita will discuss a little bit more about the incentive structure. Here on the course catalog, we are making it as easy as possible for caregivers to not only see courses that are available, but also giving them the option of various filters so that they can see based on a registration status, so that they know what is actually available and what is coming soon. They're going to be able to see based on topics of courses that are available. So those caregivers that are looking for specific skills that they're wanting to improve upon, or if they have a family or friend caregiver person in their life that they're wanting specific care for. We have training formats that they're going to be able to search for. And then, of course, with the languages, depending on what the languages the courses will be available in. When a caregiver goes to this website, or anyone that goes to the CalGrows website, they can click on the courses, get more information, see how they're eligible for incentives. And then they'll be able to register directly, and all information is provided of how they register for that course. Finding out more about incentives, this is where they're going to be able to be paid for training courses. And then additionally, as Renita talked about, as far as the retention of caregivers. And so there will be, as she'll explain, some more incentive pieces as far as retention for those caregivers. So basic steps, they find their course, they do their training, they get an incentive claim, and then they get paid. And then finally, this is available for all caregivers. This is not just for paid or unpaid. This is for all caregivers. They can receive free career coaching. And this is where I had already spoken of, where they can set goals, creating plans, helping them stay on track, providing them any help that they need. And then down here is where they can get that immediate contact with those services. And then we know caregivers are, of course, going to have questions that we've posted some of the general questions that we believe caregivers will ask having to do with the program. So that is just a quick overview of this amazing CalGrows website launch to support the program. All right, back to you, Renita.
Thanks, Angela. I'm going to now just talk about some of the core competencies that the CalGrows courses will address. So on this slide, we have 4 different categories: physical aspects of the job, emotional aspects, complexity of the population served, and workplace readiness and professional growth. And so all of the courses being offered through the CalGrows program will address one or more of these categories. And so where we actually got these categories from was research that was done by Collaborative Consulting, which is a consulting group that we brought on early in this process to help shape the design of the program. And so based on their research, these specific competencies and areas were ones that were important to caregivers, and the different areas that caregivers most wanted to see training courses provided in. All right, so there are a couple of different offerings with the CalGrows program, one of which is coaching support. So the program, we will also be offering kind of programmatic support with general technical support, help with scheduling courses, and just understanding more about the different incentives and payment information. But we'll also be offering coaching. And the coaching support is really to help caregivers think about their career and where they want to go in their career, to help them with goal setting, development of action plans, and we'll also be sending them kind of encouragement and reminders, and also help with career navigation and resource building. And so the caregivers in the program will be able to connect one-on-one with a coach to help them with these different things. And the coaching, it is optional. So if no, there's a caregiver that doesn't want to participate in the coaching, then they don't have to. But we think this is a really great resource that we're hoping a lot of the caregivers participating in the program will take advantage of. All right. So there are two different tracks, I will say, for offering incentives for caregivers. And I want to emphasize that the incentive payments that are being offered as part of the CalGrows program are only available to paid direct care workers. So unpaid family and friend caregivers would not be eligible to receive these incentives. But I'll just walk you through these incentives. So all of the paid direct care workers are eligible for up to $2,500, and these can be claimed by going to the CalGrows website. So the first level, there's a $30 incentive payment for each hour of training for courses that are in the Learn and Earn track. And then level 2, caregivers can receive a one-time bonus of $500 after completing at least 15 hours of training in level 1. And then level 3 is an additional $500 that can be received once caregivers complete 15 hours of training, and also for working at least 40 hours a month of paid work for 3 months. And so that would be a retention bonus. And so we wanted to offer these retention bonuses as well, because I mentioned at the beginning of this presentation that one of the goals of our program is to also improve retention. So that is kind of the goal of these different levels and incentives, is to hopefully get more caregivers enrolled and registered in these training programs, and to get them to hopefully stay in these roles for a while. There is a second incentive program, and the reason why these other courses are different is because they are being offered in partnership with the Department of Social Services, these career builder courses. So that is why these are on a different track, so to speak. But the career builder incentives, workers can receive up to $3,500 in incentives that can also be claimed via the CalGrows website. So this training level, workers can receive $500 for each 15 hours of coursework that they complete, and they can receive that payment twice for a total of $1,000. The practice level, they can complete the training level and another 40 hours of paid work within a month, and they would receive another $500 bonus. And then the pro level, so this is completion of the training and practice level, plus another 40 hours of paid work for an additional 5 months. So that would be a total of 6 months working at least 40 hours in each month, and they would be able to receive this additional $2,000. And again, these courses, whether they are part of the Career Builder program or part of the Learn and Earn program, will be clearly marked and visible on the website. So there will be clear explanation explaining which category each of the courses falls into and the different incentives that are available for each course. All right, this is, I'll pass it back to Angela.
Thanks, Renita. All right, so I know I have already, or we've already encouraged and stated this, but we need you to help us promote CalGrows. So we're asking you to be an outreach partner with us to help promote the program to organizations, direct care workers in your networks. And like I had said before, that we're going to provide you what you need. So we're going to provide materials to support you, like the flyers, social media posts, press release templates, and more. And so I'm going to show, so what we have available to you is a toolkit. And this will be something that, yes, it can be accessed through the CalGrows website, where all resources that you're going to need, it'll be branded with CalGrows. It'll have information that we've already come up with. So you'll also get with that, the program overview. You'll get some of the frequently asked questions that go along with the program. And then the webinars and presentation slides from today will also be posted on that toolkit. I'm going to go over the outreach guide. Then you'll see that in the toolkit, I'm going to show you what it will look like right now. So here, when you go to the toolkit, and we'll also be sending out eventually, as the launch for CalGrows approaches, we'll also be sending out an email with the link to this. But as you go through this, you'll see here you can sign up to get additional understanding and outreach for the CalGrows program. So we just gather some basic information there. We explain what you're going to get as far as the resources to support you. But down below is really where you're going to have what you're going to be able to use for the outreach piece of this. So like I had spoken about, you've got the CalGrows program info, the FAQs, policy information from CDA, any upcoming webinars that might happen, today's webinar deck, the webinar video, and then the closed captioning script also. Down here are the actual outreach materials. So I'm going to go through the basic outreach playbook with you also today. We will have flyers that will be in PDF format, so it could either be included in any digital communication, but it also could be printed out. We'll have already written newsletter blurbs. We'll already have pre-written emails and social media posts. So whenever those pieces are live, we will, of course, remove the coming soon. It'll be a live link for you. There's also going to be a way to fill out the form where you can get postcards to distribute. Down below, if there's any time that you need to contact or have questions about the program, you could fill out this help form down below on the toolkit. So this will be your go-to resource for being an outreach partner. Of course, at any time, you can email us at info@calgrows.org in order to get the additional support or questions answered that you might have. So here is the outreach guide that is included in that toolkit. One thing that I do want to really showcase is that you might wonder how often to send out emails or how often to send out social media posts. One thing that I do really want to point out here is about press releases is that we have a set process for press releases where it all needs to be approved before it being sent out. So we will touch base with you more about what those processes are. We'll include that in the toolkit, but we're just asking that press releases cannot go out unless CDA has had approval on that. All right, back to you, Anita.
All right. Yeah, so all right, that kind of wraps up our presentation for today, but thank you all for joining us. So if you have any questions or need support in any way, you can contact us at info@calgrows.org. And you can also visit the calgrows.org website for more program information. And so we have about 15 minutes left. So I'm going to use this time to go through and answer a few questions. And so I'm just going to start, let's see, at the top here, and I'll just kind of go through the questions as I see them and as they are coming up. There's a question here about asking if we want to attract new people into the field that are working as direct care workers, but they're not eligible to receive incentives from the trainings because they are not currently paid direct care workers. Then how can they even take the first steps to start? And good question. So the funding that is provided through the CalGrows program, it's federal funding through the American Rescue Plan Act, and there are specific things that the funding can be used for, and other things that the funding cannot be used for. So unfortunately, this funding cannot be used for recruitment of new workers. It's specifically being used for training and retention of current workers. However, there are other programs being implemented by the state that focus on recruitment. There are some programs at the Department of Healthcare Access and Information, HCI, that are focused on recruitment and helping to recruit new workers. So while the CalGrows program itself is not focusing on recruitment, there are other programs that are a part of the master plan for aging, and how kind of all of these different programs are working hand in hand to tackle different issues. So while we are trying more so to tackle training and retention, there are other programs that are focused more so on recruitment. There's a question, are courses available in Tagalog? Yes, there will be courses available in a variety of languages. And I do want to emphasize that courses will be added to the website kind of on a rolling basis as time goes on. So right on March 15th, I'm not sure that we will have all of the courses available in all of the different languages on March 15th. We will have some courses in a variety of languages, but if they're not there on March 15th, they will be added shortly after that. It just will take some time to get all of the courses up and running and have all the information updated on the CalGrows website. All right, there's another question. Does this include caregivers who support the IDD population? Yes, so this does include caregivers who support folks with intellectual and developmental disabilities. And so there will be some trainings that might be more focused on those who serve the IDD population. When will these courses be available? So the website is set to launch on March 15th. And so at that time, there will be courses available or courses on the website. And I will say each course might have a different schedule. So I can't say off the top of my head when the first courses will be available, but all of the course information will be on the website on the 15th. And you can look at each individual course and it will have the schedule for those courses. And you can see then when they will be offered. Is there another question? Is there any identification of whether courses are targeted to adult day services versus residential care? Or is it just based on competencies? There is a mixture of both, because I think there are some courses where the specific trainings that are offered are common to both workers that work in adult day services and workers that work in residential care. So where whatever skill or the course is training folks on, that folks that work in either one of those settings would be useful for them to take part in. But then there are other courses that may be specifically targeted to caregivers that work in adult day services or caregivers that work in residential care. So it depends. Some will be targeted to a specific setting, some will just focus on a specific competency. But all that information will be in the course information that was on the website. I presume you have a set of courses that meets the state's requirements for home care aides to be registered with them. And I apologize, I always get home care aid and home health aid mixed up. But there will be courses that I think can meet the state's requirements for home care aides. However, I do want to emphasize that there is no certification that will be offered with the CalGrows programs. But I think that there can be, there will be courses that may meet the state's requirements for home care aides, but we won't be offering any type of certification or anything like that. So is there a marketing budget that CalGrows will use to pay organizations to spread the word? As of right now, we have kind of a marketing campaign that we are doing, but there, as far as kind of asking organizations to help us spread the word, we won't be paying organizations to do that. So, and understanding that this is a lot of work on organizations just to ask them to help us spread the word. So we understand that, and if organizations don't have the capacity to do that, we totally understand. But right now, there aren't plans to kind of pay organizations to help us spread the word. To question, will the session be recorded? And where can I find the recording after today's webinar? Yes, the session will be recorded. And actually, I might have to ask Angela to help me with the question about finding the recording. Well, actually, I'll let you speak to that. I'm not sure, sorry.
No problem. So we will have it available on the toolkit that I showed, but then there is the possibility we can look into is those that have attended the webinar, that we could also email out the link for the recording.
Thank you. Is there an opportunity to partner with awardees on this grant? So we will be listing the awardees on our, or the grantees on our website. And so if there is an organization that you would like to partner with that has been awarded, I would recommend reaching out to that organization to kind of talk to them and see about working with them on kind of spreading the word for their training courses. There's a question, does this apply to caregivers employed by adult daycare programs? Yes, so this does apply to caregivers that are employed by adult daycare programs. And so in general, adult daycare programs would be eligible for this. Residential care facilities for the elderly, caregivers that work in those settings would be eligible for this. And then caregivers that actually work with folks in their own homes would be eligible. And there is, if you want to kind of see some examples of different settings that would be eligible for this, on our CalGrows website, we have a little kind of a table that shows the different settings and the different types of workers that would be eligible for CalGrows. Can a family member of a PACE patient who serves as a caretaker also benefit from this program? Yes, so family members that act as caregivers can also take these courses free of charge. They won't have to pay to take any of these courses. The family members will not be eligible to receive the incentive payments for taking the courses, but they will be able to participate in the courses and take them free of charge. Here's a question: can staff that work in the office area, like administrative, but want to get trained, would they be able to get the incentives? So unfortunately, no. So this is specifically targeting those folks who want, folks who are currently employed as a direct care worker. So they are providing kind of assistance for activities for daily living to either older adults or people with disabilities. So unfortunately, they would not be able to get the incentive. However, if they are a family or friend caregiver, they could certainly take the courses, but they wouldn't be eligible for those incentives. The question is this for onboarding of new employees or for current staff? So this, the training courses here, I think if there are employers who suggest that kind of their new employees participate in some of these courses, I think that, that's fine. So it could be for new employees, it could be for staff who have been working for a while. So I think definitely there are courses that would be useful to someone who's been working for many, many years, as well as someone who is new to the field and has just started out working in this career. There's a question, are caregivers that work in the program of all-inclusive care for the elderly or PACE eligible for this program? Yes, they are. So caregivers that work in that program are eligible. Is there an expectation that workers will do this training during their scheduled hours of paid employment and also be provided with a wage or on their own time outside of work time? I think that is dependent on the type of course that they take. So, for example, there are some online courses that are being offered kind of to a wide audience. So it's not one employer offering training to their employees. So in that instance, I would imagine that the caregiver would have to kind of take the training on their own time outside of work time, although they would be receiving the incentives and the $30 for each hour of training that they take. However, there are other programs, or excuse me, other courses being offered by employers that are specific to their employees. And in that instance, there may be employers that are allowing their workers to do the training during their scheduled hours of employment and would be receiving a wage. So it's different depending on which course you're taking and if you are working for an employer that is offering training courses through the CalGrows program. There's another question here. Can we do the trainings in a group as part of a staff meeting, or do the workers only earn the incentives if they do the training individually? And for this question, I think for most, I would say most of the training courses, I think it's helpful if the courses are done individually. And I might need more clarity on what kind of you would mean by doing the training as part of a group. But I think having kind of individually do that might be beneficial. And also, depending on the type of training it is, it may be something that is offered in a group, because I know that there are some training courses that are kind of more focused on providing training in a group setting. So I think it would depend on the training course that you take, but most of them are designed to be taken individually. So and actually this will be our last question. I just looked at the clock and it is 10:45. So our last question, my team of caregivers are employees of our hospital, but are non-medical in-home supportive care providers. Our clients are not usually former patients of our hospital. Will they qualify to participate in this program? And I would say yes, if those employees are providing in-home care, non-medical in-home care, then they would be eligible, even if they are technically employed by a hospital, as long as the work that they are doing is not being done in a hospital setting, then they would qualify. And I see that we are past our ending time of 10:45. So I thank you all for being on the call. I know we didn't get to all of the questions, but you can visit our website for more information, and you can also email us at info@calgrows.org if you have additional questions that we were not able to answer today. So again, thank you all for being here, and thank you so much for being interested in the program and considering helping us get the word out for the program, because we could not do it without you folks on the call. So thank you so much and have a great day, everyone.